name is Audrey. I'm 19 and I am in a LVN program at Unitek College.
And my name is Jonna. I'm 22 years old and I'm also in the same program as she is.
So I chose nursing because there's a lot of influence from my family. A lot of my cousins are in the medical field. I've always felt like I wanted to help people, and I think nursing is the perfect way to do that. So our program is a little different from traditional colleges. We're in accelerated LVN program. It's about 12 months. We go to school Monday through Thursday. We also do clinicals. We have lectures, lots of tests, and it's a really fast pace.
Yeah, not only you go to school, but you have to visit facilities, and then that's where you adapt to the skill.
Yeah, that's what I like about it, is because it's different to learn in the textbook. Once you go out taking care of patients, actually being immersed in the environment, it's totally different. You're learning way more hands-on.
And you also get to communicate with patients, and that's the biggest thing that you can learn from other people.
Yeah.
Distraction is the number one thing. I feel like if you're not in class, you get distracted easily, and then you tend to just wander. You can't really focus.
I feel for us, since we're in this program, we're before this, we were in one classroom with the same people for 8 hours a day, and that kind of made us, since we were there, present, we had to learn. There was no other choice but being at home, being on a Zoom lecture for 10 hours sometimes. It's really hard to just sit there the whole time and listen. Especially when you have multiple lectures, after a while it gets really tiring, and there's just a lot of at-home distractions that that play a big factor in kind of hindering our learning experience. For me, I feel it's encouraging me more. I feel I see all these people putting their lives at risk to treat patients, to work these crazy shifts with limited resources, and it kind of made me appreciate it more and have more respect towards it. And I'm excited to be going into the field really soon.
It does encourage you, yeah, it motivates you to just keep focusing and then eventually get there.
Seeing that doctors and nurses have died during this pandemic, it's scary, but that's why there's precautions in check. But yeah, it's what you sign up for. We know the risk, but I think the reward of being able to treat someone, especially during this time, is really rewarding and worth it.
Skills. I feel that's the most important thing we need right now, is just hands-on skills, and I feel we're not getting enough hours, because obviously we need those to graduate and need those to implement in other healthcare facilities.
Right, because we're doing online clinical simulations, but it's totally different.
It's not the same.
It's not the same. I look forward to going to clinicals, because when you shadow a nurse and when you're actually being able to do treatments, give medications, it's very different from what you're learning even in skills in the classroom.
And it's not challenging, so you don't really get to learn.
When you're actually having hands-on experience, you get a better understanding of how to deal with patients and determining what they need. Having a simulation online is really hard to do that. I think as our instructors, I think they're trying the best that they can. As for the school though, I don't know, they should refund us some of our money. We're paying $40,000 to get the hands-on experience. That's I know why I signed up for it, to actually be there and to get that experience. But since we're not being able to get that for 2 months now, I feel they should compensate us a little bit better.
Honestly, it just made me stay home more. That's all. If I'm gonna be honest with you. But advantage, I guess, for being in the online school is you get to have more time, and you don't have to commute if you live far. You don't have to waste your gas, and sometimes commuting just takes your time from studying and from all the schoolwork that you have to do.
I guess since we're nursing students, we kind of have a better gauge for what's actually the scientific reasoning behind it and stuff like that. So we have the knowledge to take like those precautionary actions, be able to like, you know, educate others around us.
Always wash your hands. It's like the key to preventing, you know, the spread of
Literally, that's it.